Good morning, everyone, and thank you for being here this morning. I'm very happy to see all of you here to attend our webinar about MS today. So for those who don't know me, I'm Dr. Beatrice Benedetti. I'm one of the consultant neurologists at Cleveland Clinic, and along with Dr. Anu Jacob and Dr. Victoria Miswood and our MS coordinators, Gina and Eslam, I'm taking care of the MS service at Cleveland Clinic Abu Dhabi. So before starting, I wanted to thank you, the Salama Foundation, for supporting us in our project. So today we have pre-recorded sessions, and at the end of the sessions, we are going to have a Q&A session in which you can put your questions in the question box, and we are going to answer live. So today in this session, we are going to talk about 7 things you need to know about MS. So we are going to start talking about the emotional aspects of MS. Then we are going to move towards the physical aspect and how to feel healthy having MS. Then we are going to talk in details about how to manage fatigue in MS, which is one of the most common symptoms, as you probably know. And then we are going to move and talk about the future of MS and future medications. So let me start introducing the first speaker, Dr. Kelly Hoffman. Dr. Kelly is a psychologist. She is specialized in helping people with chronic conditions, including MS. So she can help patients coping with the diagnosis of the disease, which is one of the more difficult aspects of the disease. And then she can help patients throughout the whole course of the disease, coping with fatigue, anxiety, depression, common symptoms that can occur. She can help patients and their family. Dr. Kelly has been trained in the US, and before joining Cleveland Clinic Abu Dhabi, she was working at the main campus in Cleveland Clinic, Ohio. And we are very happy to have Dr. Kelly with us today. Please go ahead, Dr. Kelly.
I'd like to start today by thanking Dr. Beatrice for that warm welcome and introduction. As you know today, our theme is 7. So we will be discussing a variety of different strategies you can use to cope with your MS. On my part, I'll be discussing with you today 7 different strategies for emotionally coping with MS. So what I've tried to do today is I've tried to make the presentation both pragmatic and also research-oriented. So what that means is I'm going to be sharing with you concrete things you can do. So one of my goals today is you will take away concrete things that you can do, as well as explanations for why they're important. So for those of you who are interested, I will also share with you from the research literature the reasons why these strategies are effective for emotionally adapting and coping to MS. I'll start today with telling you a little bit about me. So as Dr. Beatrice mentioned, I'm Dr. Kelly Huffman, and I am a licensed psychologist. I am licensed to practice both in the United States and the UAE. I've been living now in the UAE for approximately 3 years, and my specialization is helping persons with chronic health conditions, such as yourself. So things like multiple sclerosis, chronic pain, sleeping problems, and I also have experience in women's health issues. Prior to coming to the UAE, I worked at Cleveland Clinic main campus. I have about 10 years experience in helping people with chronic health problems, including a postdoctoral training and a doctorate in counseling psychology. And I'm really excited to be here with you today and share with you more about proven strategies to cope with your multiple sclerosis. Today, I hope what you will take away, you'll be able to discuss ways to emotionally cope with your MS. You'll be able to minimize how much MS interferes with your daily life. I hope to share with you why psychology can be an important part of treatment for chronic health problems. And by psychology, I mean how you think, how you feel, and you behave at home. And also if you need support, to let you know what services we have here at CCAD. And finally, as my final tip, I opted to include tips for friends and family to emotionally cope with MS. Friends and family are an important part of a person's with MS treatment plan, and I wanted them to leave today with some specific things they could do. Okay, and with that, my first tip, and this one might surprise you, is in order to emotionally adapt with your MS, it's important to approach the disease from a whole person perspective. And so what this means is receiving comprehensive care for your MS. Here at Cleveland Clinic Abu Dhabi, we are fortunate to be able to offer you these services. So when I say comprehensive care for MS, what I mean is approaching your disease from a biological, a psychological, social, and spiritual aspect of your. When you approach the disease from all these different perspectives, often people have better treatment outcomes. Your care might include multiple team members. Who you include on your team is individual to you. You'll always have your clinical coordinator. Depending on your particular concerns, you may also see psychology, neuropsychology, psychiatry, occupational therapy, PT, rehabilitation, ophthalmology, urology, and of course, we hope to include your loved ones in your treatment plan. So this is tip 1. Tip 2, when receiving your comprehensive care, it's important to be an active partner in your healthcare. What this means is that you are in charge of your treatment. You get to assemble your team. You can find a physician with whom you're comfortable and approach this from the perspective of building a patient-physician partnership. So we're here to help you, but we also hope you will ask us for what you need. So if you feel you need to see a physical therapist, let your neurologist know. If you want psychology, if you feel that will be helpful, we're here, and we have all of these team members to help you. And finally, part of being an active partner is learning as much as you can about multiple sclerosis and its management. So find reliable sources online, ask questions, read. Okay. Tip number 3, it's normal and okay to have emotions about your MS. So tip 3 is acknowledge these emotions. One of the things we found is that having emotions about MS itself is a normal emotional reaction. In fact, most patients with MS report some emotions. When people are diagnosed, maybe some people feel worried, maybe some people feel shocked, maybe some people feel angry. Some people even feel a sense of relief. Many of you probably struggled with symptoms that you couldn't quite explain, or feelings that you had that you weren't really quite sure, am I imagining this? Is this all in my head? And actually getting the diagnosis can bring a sense of relief. In the longer term, perhaps you might feel grief regarding to the changes you have to make in your life or the impact of the disease on your life. Maybe you feel guilt. You're worried about how this impacts your loved ones. These are all normal reactions to the symptoms of MS and the changes caused by the disease or the uncertainty of the disease itself. So if there's one thing I can reassure you of today, it's normal and it's okay to have feelings about having MS. Now, sometimes people also have emotional changes as a result of the disease. So there's the first part, the reaction to the disease, but also emotional changes as part of the disease itself. It's common for people with MS to experience depression. Depression can make other MS symptoms worse, such as fatigue or cognition, and the depression can actually interfere with the ability to function in daily life. Now, it's important to remember depression is not a sign of weakness, and depression is actually quite treatable. We have a number of effective treatment options here for you at CCAD, including psychotherapy and pharmacological options. Many people with MS will report having an anxiety disorder. This makes sense. Living with a chronic unpredictable disease such as MS can be anxiety provoking, and many people with MS report worries about the disease. If you have depression and anxiety, it's important to treat. And I'm going to tell you what the literature says about why. Depression can actually worsen MS symptoms such as fatigue or cognitive functioning. And depression and anxiety can make someone with MS have a worse quality of life. So if you treat the depression, you might actually get some improvement, not just from your emotional symptoms, but some of the other concerns that you have with your MS. Okay. And number 4, tip number 4, use positive coping strategies. And I'm going to tell you a little bit more about what I mean. When I say positive coping strategies, what I mean is strategies that are active and problem focused. So if you remember back to the beginning of the presentation when I said things you can do. So what you can do is really important. So things like planning your time, solving other problems you might have in your life, seeking support, things like exercise, mindfulness, participating in family life, participating in social recreational activities. So again, things that you do and things that are problem focused. So things that you're seeking in order to solve problems either in your life or related to your MS. Coping strategies that we think of are negative are those that are passive or emotion focused. So perhaps you avoid thinking about your MS, perhaps you avoid emotions you have for your MS, perhaps you do not spend time with your friends or family, maybe you sleep too much or too little as a way to cope. These coping strategies are actually highly related to a person's quality of life, okay? So my challenge to you today is to identify 4 to 5 positive coping strategies, and these are going to be really individual, and think about how you might plan for them and incorporate them into your daily life. Okay. One positive coping strategy, of course, is relaxation and stress management. Many persons with MS find it beneficial to monitor their stress and actively work to decrease the stress levels in their life. One good reason for this is MS is stressful in and of itself. So lowering other stressors in your life gives you more resources to deal with the MS. But in addition, some studies have shown that increased stress is associated with increased perception of symptoms. And some people have even reported an association between flares of MS and stressful life events. So when managing your stress, again, my challenge to you today, launch a self-inventory. So think about what works in your life, what doesn't, and what are the things you need to change. And remember that while your stressors might not be changeable, you can control your response to the stress itself. I've included another slide about mindful breathing. I will let you review this on your at home today in interest of time, but I will leave you with one thought. So mindfulness-based interventions incorporating relaxation have been shown to improve quality of life, depression, anxiety, and fatigue in persons with MS. Okay, so tip number 5. And this might sound strange, but how you think about your disease matters. So your approach to how you understand your MS and how you conceptualize it is important. One of the things that's important to do is recognize any negative beliefs or predictions you have about your MS. I want you to pay particular attention to those that cause you to feel depressed or stressed or anxious, or those that lead you to engage in negative behaviors, okay? And once you've noticed these beliefs, we're going to talk a little bit about how you can catch them. So catching them, noticing them is the first part, how you can check this belief, so how you can think about whether or not this belief is accurate, and then how you can challenge or change the belief, okay? I'm gonna give you some examples. So sometimes persons with MS are worried about how their disease affects their family. So they might find themselves thinking something like, my family deserves better than me. And when they have these thoughts, perhaps they feel guilty or maybe even depressed. And these feelings can lead them to do things like withdraw from their family and be inactive, okay? So let's get back to the my family deserves better. So we've caught that thought. Now, how do we check it, okay? So one thing you might want to do is take a step back and realize MS is only one piece of your life and one piece of who you are. So perhaps you have MS, but perhaps you're also a kind and supportive spouse, you're a good parent, and you have good relationships. So that can help you to challenge that thought that your family deserves better when you realize that you're providing all of these other good things to your family. And if you're able to change that thought, you still might feel a little sad, but some of the guilt and depression will be lessened, okay? So similarly, I have another common negative thought persons with MS often have, particularly at the initial stages of their disease. So they think, I'm going to become disabled, right? Now, one way to catch and check that negative thought is to realize that thought is essentially a future prediction. In reality, the majority of people with MS do not become severely disabled, and we don't know what your disease course will look like. You can think of your disease as being in God's hands. Now, notice when you think I'm going to become disabled, you might have thoughts of anxiety or helplessness, and this might lead to things like avoiding activity or avoiding being an active partner in your treatment plan, okay? So notice how subtly changing those thoughts can help you both emotionally and managing your symptoms of MS, okay? Now, one of the reasons this is important is acceptance of MS is associated with better personal and marital adjustment, better mood, and greater life satisfaction and quality of life. In summary, I hope this message is empowering, and what you take away today is that you can change your response to your disease by challenging and changing unhealthy thinking patterns. And then finally, you might find that this is really hard to do on your own. That's true. And if you do, one of the things we offer is cognitive behavioral therapy. So cognitive behavioral therapy, in brief, is professional support that helps you to identify and change the negative thinking patterns we've discussed today that are associated with difficult feelings and behaviors in MS, okay? Tip 6. So for tip number 6, it's important to communicate with your loved ones. When people have MS, often one of their first reactions, especially at the early stages of the diagnosis, is to withdraw. Perhaps people feel like they might be a burden to their friends or family. One of the things we know is that if you're able to communicate about your MS, that's been shown to be important to not only your own well-being, but the well-being of your family members. When people avoid discussion of the disease, both partners become more distressed, okay? So effective communication improves psychological well-being in the family. And as we know, when you have MS, there's actually a lot to talk about. So MS can change relationships. Perhaps it changes who does what in the home. Perhaps your family member needs to help you more. And perhaps it affects your own roles and responsibilities in the family, okay? Another reason it's important to communicate is family members of persons with MS may also struggle with their own feelings. Family members may be reluctant to talk about this as they don't want to be an additional burden upon you. I have a research study at the bottom of the slide I'm going to review briefly. Family members often were confused or have knowledge about what MS is. Family members reported their own emotional distress. And sometimes family members also felt overwhelmed. And communicating can make this a lot better for everyone in the family. And communication can be a way that you, as a person with MS, can support your family members. And I've included a how, so talk about it openly. Approach the problem from the perspective of a family, share your concerns. This might surprise you, but it's okay to include your children and even encouraged. What you share with them is going to be different depending on the age and involve your family in your treatment. And finally, as our final tip for family members, how do you support someone with MS? As family members, one of the first things you can do is actually learn as much as you can about MS. So you can do this by seeking out reliable information. I've given you a website and a phone number for the National MS Society that's full of reliable information and resources for family members. You can let your loved one know you'd like to be included in their treatment. This will give you a chance to ask questions of their healthcare providers. How to be supportive. One thing that's important to remember is to foster independence. So a person's with MS symptoms are going to vary over time. So what this means is what they need from you will vary over time as well. So it's important to have continuous communication in order to figure out what you might do to be helpful. It's important that you do not avoid talking about MS. It's also important to avoid focusing on it excessively. So your family member is all sorts of other things outside of their MS. Another way to be supportive is to simply ask the person what he or she needs. And our final slide today, so some final tips for support: communicate, problem solve together, approach the problem of MS as a family. And then finally, and this one is really, really important, so I'm going to slow down for a minute here. As a family member of a person with MS, it's important for you to take care of yourself. Self-care is not selfish. You will have your own feelings and reactions, such as grief, anxiety, or sadness. You may feel tired, you may feel fatigued. An important thing you can do for yourself is creating your own personal wellness plan along with your loved one. And then finally, you can also get support if you need it. This can be from friends or family, or even from professionals. We are here to support you as family members with MS as well. Okay, and these are the references I used for my presentation. And then finally, I want to thank you for your time and thank you for spending this Saturday afternoon here with us. And I wish you all of the best.
All right, thank you so much, Kelly, for all the tips. Thank you so much, Kelly, for all the tips you gave us and our patients today. So we're gonna move now to the next talk. Our physiotherapist, Vinod Ravindran, we are happy to have him here today. He's our senior physical therapist at the Neurorehabilitation Department at Cleveland Clinic Abu Dhabi. Vinod has a long experience in treating people with neurological conditions, and he received a particular training and certification on patients with MS. Vinod has been trained in the US, and he worked in several facilities in the US before joining us at Cleveland Clinic Abu Dhabi. And we are very happy to have Vinod today with us, talking about 7 ways of keeping active at home with MS. Please, Vinod, go ahead.
Hello, everyone. My name is Vinod. I am a multiple sclerosis certified physical therapist working in the Neurorehabilitation Department at Cleveland Clinic Abu Dhabi. I'm going to present today about 7 different ways of keeping active at home for people with multiple sclerosis. So the objective of today's presentation is to outline 7 different activities or techniques that can help multiple sclerosis patients to maintain good functional status, and also explain the rationale and research behind each technique. All right, here is an outline of the 7 different home exercises that we're going to talk about. Deep breathing exercises, lower extremity stretching, core activation exercises, aerobic exercises, resistance exercises, balance exercises, and gaze stabilization exercises. All these different types of exercises in a little bit in detail, and I'm going to explain how these exercises can be done easily at home. That's the main core of the presentation. All right, let's start with the deep breathing exercises. As we all know, fatigue is one of the most reported symptoms in MS, and breathing exercises have shown to decrease fatigue and improve activity tolerance. So I'm going to explain the right way of doing deep breathing exercises. So breathing in through the nose and holding it for 2 seconds, and then breathing out through the mouth and holding it for 2 seconds. While breathing out, it's important to keep the lips a little bit closer, like you're going to blow a candle. That's called pursed lip breathing, so that you breathe out completely with the pursed lip and hold it for 2 seconds. And while doing this technique, we need to remember to keep the shoulders relaxed. And the normal recommendation of this technique is about 10 to 15 repetitions, 3 times daily. The second technique that we're going to look at is lower extremity stretching. We all know that spasticity or muscle stiffness affects more than 80% of people with multiple sclerosis, which affects their daily activities and participation in daily activities and quality of life. Lower extremity stiffness in multiple sclerosis actually leads to fatigue, and it also limits the ability to walk and can also cause falls, in some cases. It has been shown that daily stretching of lower extremity muscles improves the flexibility and also improves walking, decreases pain, and also decreases falls. The usual recommendation for stretching is about 30 seconds to 60-second hold of each muscle, and it's done daily. We're going to look at some of the common or some of the most important lower extremity stretching. The first muscle that we're going to talk about is hamstring. And I've shown in this picture here 3 ways of stretching the hamstring muscles, one in lying, one in sitting, and one in standing. Hamstring stiffness is very common with multiple sclerosis. That limits the walking pattern of the patients. It plays an important role in the step length. And when hamstring muscle gets really stiff, the step length decreases, and that results in falls sometimes. So hamstring stretching is very important to relax these muscles and improve balance and walking pattern. The next important muscle that needs focus is the calf muscle. So I've shown here 2 ways of stretching the calf, one in standing and one in sitting. And this also helps to improve the walking and the balance. The next one is quadriceps and hip flexor, hip muscles. So the top picture shows how to stretch the quad muscle in standing. And the bottom picture shows how to stretch the hip flexor muscles in kneeling position. Okay, the third technique that we're going to talk about is core activation exercises. Balance and mobility impairments are very common in people with multiple sclerosis. And core weakness and trunk instability are shown to be the primary reasons for these balance deficits. And there are several studies that have shown that core stabilization and strengthening exercises have proven to improve trunk stability and decrease falls. These are some of the common core activation exercises. One is pelvic tilting that's shown on the top picture. It's done by just lying on your back and tilting the pelvis up and down, like arching the back up and down. So the pelvic tilts forwards and backwards. And this activates the core muscle. The second technique is pelvic bridging, which is on the right side, where you lie on your back with your knees bent and lifting the hips up and down. And the third core activation technique is rectus activation, the abdominal muscle activation, which can be done in 2 different ways that is shown in the bottom picture. You basically lying on your back and bringing both knees towards the chest. If that is too difficult, then bringing one leg at a time. And these exercises can be done up to 15 repetitions 2 times daily. The next technique we're going to talk about is aerobic exercises, which is, in other words, we can say cardio exercises. So studies have shown that aerobic training in multiple sclerosis causes decrease in fatigue, improved mood, and improved general conditioning. Low to moderate intensity is recommended, 30 minutes a day for at least 5 times a week. So low to moderate intensity is calculated. You can calculate with your max heart rate. So I'm going to explain quickly how we can calculate that. So to get a max heart rate or target heart rate, you basically subtract age from 220. That gives the maximal heart rate. And 60 to 80% of that number gives you the actual heart rate that is recommended in multiple sclerosis patients. So for example, if a 40-year-old is trying to calculate his target heart rate, it will be 220 minus 40, which is 180, which is the maximal heart rate, which is 100% of the heart rate. And the recommendation for a multiple sclerosis patient is 60 to 80% of that number. So they'll be, you'll be working out with a monitor or a smartwatch or something like that. And if 180 is the maximal heart rate, you calculate 60% of that 180, and you make sure that when you're exercising, your heart rate stays within that value. And these exercises can be done either, walking outside, walking on a treadmill, cycling, can be done using an elliptical. So any kind of cardiac equipment can be used for this. And the key is to have a monitor that kind of monitors the heart rate, and it needs to be between 60 to 80%. The next technique we will talk about is resistance training or strength training. Weakness is one of the common symptoms in multiple sclerosis, especially with lower extremities. And strengthening exercises have proven to improve strength and improving the activities of daily living in people with multiple sclerosis. And the daily recommendation is low to moderate intensity strength training. And it is shown to decrease fatigue and improve quality of life. And these exercises can be done, on a regular basis, on a daily basis, and can be done like individualizing different group of muscles. For example, shoulders on one day, arms the next day, leg muscles, the following day. So it can be just kind of a quick strength training exercises for one group of muscles every day at a low to moderate intensity. The next technique is balance exercises. Like I mentioned before, falls are very common in multiple sclerosis, and there are studies that have shown that 56% of multiple sclerosis patients have at least one fall within the 3 months of diagnosis, and 37% of multiple sclerosis patients are classified as frequent fallers. Simple balance exercises have shown to decrease the risk of falls and prevent injury. And I've shown a couple of exercises in this slide. One is standing on one leg with a chair in front, just in case, if you lose balance, then you can hold on to the chair for safety. And then the bottom picture shows leaning forwards and backwards. That also improves dynamic balance. And collectively, these exercises helps, to improve balance while standing without support or even walking. The next technique is gaze stabilization exercises. So gaze stabilization means focusing on an object while your head is moving, or targeting, on different objects when you're walking. So when there is a problem with gaze stabilization, usually patients feel that they are unstable and leads to falls. And there are studies that have shown that gaze stabilization exercises improve balance and they decrease falls in MS patients. I've shown here a couple of gaze stabilization exercises. One is sitting nice and relaxed and keeping an object in front of you, and then turning your head from one side to another, focusing on the target. So your eyes are focused on the target, and moving the head from one side to another is one of the exercises. And the second one is holding your thumb in front of you and then moving the thumb forwards and backwards and side to side with your eyes following the finger. The head stays stationary and the eyes move and they follow the finger. And these are two common gaze stabilization exercises that helps with gaze stability and improves balance while walking, especially on the streets when there is a lot of things moving around. It helps to focus on these objects and improve balance. So as a conclusion, there are several studies that have shown that exercises benefit, in people with multiple sclerosis, and a lot of these benefits are shown on. It decreases pain, decreases stiffness, it improves walking performance, it improves aerobic capacity, it improves strength, it decreases inflammation, it decreases neurodegeneration, it decreases fatigue, decreases cognitive problems, improves mood. So exercise have a lot of benefits, and it's done in the right dose and in the right way, it can definitely help people with multiple sclerosis to improve their activities of daily living and also their quality of life. So these are 7, we just went through these 7 easy techniques that can be done very easily. Especially during the pandemic, it's difficult to access a gym or work out in a group or something like that. So these techniques are very simple and they don't need a lot of equipment and can be done very easily at home, and they can provide better quality of life for these people with multiple sclerosis. So I would definitely encourage multiple sclerosis patients to follow these exercises on a regular basis and improve their quality of life. Thank you very much.
Thank you so much, Vinod. Keeping active is actually very important for everyone, but even more for patients with MS, as you said. So let's move to our next speaker. Professor Anu Jacob is the director of the Multiple Sclerosis and Autoimmune Neurology at Cleveland Clinic Abu Dhabi. He has been trained in India, in the UK, and in the US. And he has been working in the UK before joining us at Cleveland Clinic Abu Dhabi. And he was the winner of the Royal College of Physicians London Award in the UK. Professor Anu published more than 100 papers on the topic of MS or similar conditions. And we are so proud and happy and honored to have Professor Anu Jacob today with us to talk about fatigue in MS, how to manage fatigue in people with MS. Please go ahead, Dr. Anu.
Good morning again. So, how many of you are feeling fatigued? How much is your battery level? If you're feeling fatigued, score yourself or rate yourself with the scale on the right side, with the stick man. Are you a 1 or are you 10? Do you just want to go and sleep rather than listen to this boring talk? Well, if you're fatigued, you aren't alone. And today I will hopefully tell you several ways of managing fatigue in MS. First, let's understand fatigue. Fatigue is the most common MS symptom. It's an invisible symptom. It's very difficult to explain to others or show it to others. You tell your family and friends, I'm feeling tired. They will tell you, yeah, I'm also feeling tired. But your tiredness and their tiredness are entirely different. It's a lack of energy. It's extreme exhaustion. Some days it's predictable. Maybe it's exercise. Maybe it's walking 15 minutes. Maybe it's in the afternoon. Maybe it's after food. Maybe it's at the time of your periods or your menses. And some days it's totally unpredictable. It comes out of the blue. It can be occasional or it can be daily. It makes many of the other MS symptoms worse, but it's actually not a new relapse. Whatever it is very disabling. It is difficult to cure, but almost everyone can improve it. And that is what we are trying to do. But the first step really is to understand how MS fatigue occurs. Let me give you an example. If you have a viral infection, like the flu or God forbid, COVID, you're going to be very tired. Why is that? It's because the immune system, the white blood cells, is releasing substances, cytokines or chemicals that is trying to fight the infection, but it also makes you tired. In MS, the same thing. Inflammation, the autoimmunity, the immune system trying to damage the nervous system, is releasing substances which can make you tired. That's one. The second is an electrical problem. MS may have damaged the myelin in your nerves, and therefore electricity doesn't flow very well. The energy required to send electric signals down your body through your nerves is much more than normal. And when energy becomes less, what does your body do? The body does what your iPhone does. It says, low battery, time to recharge, time to rest. There are two types of MS fatigue. One is the physical one, and you will know it. You cannot walk beyond a certain point, or you cannot continue certain activities. You want to rest. The other one is the cognitive fatigue, the mental fatigue. Let's say you start a meeting with somebody. It's a half an hour meeting or an hour meeting. The beginning of the meeting, you are sharp, everything is working fine, you're understanding everything. But after about half an hour, it's all a bit too much. It's a brain fog. You just can't process it. You know, brain utilizes 25% of your energy. So mental activities are very energy consuming. And when there is demyelination, it may take a lot more energy than is normally required. So again, time to recharge your batteries. So how do we manage fatigue? Well, the first and most important thing is to understand yourself and your fatigue. Everyone's fatigue is going to be different. So I recommend from now onwards, from today onwards, keep a diary. Understand, talk to your family. When do you notice you need to be more tired? What days, what times, what activities, how much duration of the activities makes you tired? Is the tiredness there in the morning when you wake up? Is there a relationship to food? Are you not taking enough fluids? Is it on those days? Do you notice that some medicines make you more tired? Is it more during your periods? Do you have a headache along with your tiredness? Is it migraine as well? Is stress causing the problem? Or are some people stressing you out? Is your fatigue response is because of some friends, your neighbors, your mother-in-law, your boss, or is it your doctors? What is making you fatigued? So think about all these things. And you may see that some patterns are evolving. And then can you predict your fatigue? If you can, well, that's step number one. The second thing is to conserve energy. Think of this example all the time. You are like a phone battery. You want to be 100% and some days you're 100%. But many times the energy is drained. And as the energy comes down, you don't continue to do everything that you're meant to do. You decide what is important and what is not before it shuts down, before you have to lie down and sleep. So it's very important to have this concept in your mind. There is a definite amount of energy that you have in a particular day. Utilize it wisely. And there comes the 3 P's of managing fatigue: prioritizing, planning, and pacing. Everyone has a big list of things to do. Work just expands and takes up all the time. But we all have to prioritize what you have to do. There are a few things that on a day-to-day is important. On a work day, you have to work. That's top priority. On the weekend, you have to spend time with family. You can't be going shopping on the same day as you're going to work. You know, everyone, you know your own life, but prioritize what is truly important. Tell others, no, I can't do it today. Plan your day. If you're going out to for shopping, well, make sure you buy everything. Also go and pick up the kids on the way. Pace yourself. Match the tasks that you have to do with your ability to do it. Let's say your friends say, oh, let's go for shopping. Sure, you're okay for that. Let's go shopping in Dubai for the whole day and then have a meal and come back in the night. Well, really? No. Maybe you want to say, why don't we shop in Abu Dhabi and let's shop for half the day? Somebody says, let's go for a movie. Come at 7, it's a 2:30 movie. Come, let's meet at 2:15 in the car park. No, you go and reach at 2 o'clock. Take your time walking to the mall, to the cinema. Take your time in doing things. Is your sleep good? Do you wake up refreshed? The brain uses a lot of energy. It produces a lot of waste. Sleep is when the waste is removed. So unless you sleep well, you are not going to be refreshed. If you're not sleeping well, why is that? Is it pain? Is it anxiety? Is it stiffness? Do you have to get up in multiple times in the night to go to the toilet? Is your sleep habit good? Is your partner snoring? Are you snoring? So these things may be looked at because under-refreshing sleep adds to your MS fatigue. Exercise regularly. I know Vinod has already talked about this quite a bit, but let me re-emphasize. Even without MS, people can be unfit. They can't climb a flight of stairs. With MS, it is entirely possible that your lack of general fitness makes your MS fatigue worse. So please exercise in whatever way you can regularly. Body posture is very important. Incorrect postures use up a lot of energy. Let me give you an example. Suppose you were to hold your baby out, or baby, your child, your neighbor's child, your grandchild in front of you in your arms like that. How long can you hold it? Few minutes before your arms get all tired? On the other hand, if you put your baby on your shoulder, you can hold for much longer time. Why is that? Well, our spine, our body, our muscles are all very dynamically, very built in a manner that we can carry our body weight, 60, 70, 80 kilograms easily. But we have to use it correctly. We have to use the right posture. So same thing applies when you sit somewhere and just walk around, make sure you have the right posture so that you conserve energy. Is your fatigue more than MS? Are you blaming your MS for other things? What about stress? Are you anxious? Are you depressed? All this can color your fatigue. Important, very important. Tell people about your fatigue. Explain what you're experiencing. Explain to them their battery concept. Tell your family, your friends, your work colleagues that you have a physical health issue and that prevents you from having the full battery every day. There are some days when you will need help, and ask for help. If you don't ask them, they will not be able to give it to you. It is okay to tell, and once people understand, they will help for you. Ask your spouse, your children, your friends, and they will all help. When you come to meet us, talk to us. Tell us about your fatigue. Raise the question, is my fatigue more than MS? Are there any other conditions that is responsible? No, anemia, thyroid problems, vitamin deficiency. Are some blood tests required? Do we need a sleep assessment? And very, very importantly, many medicines can worsen fatigue. So get rid of unnecessary medications. Is your MS well controlled? Are there relapses happening without your knowledge? An MRI scan can help. Are there medicines that can improve fatigue? Yes, there are a few. None of them are amazing, but they can help. Amantadine, modafinil, aspirin, famotidine, some antidepressants can help. Caffeine taken occasionally can help, but taken every day, caffeine can make things worse. It can certainly disrupt your sleep and make you more tired. So, in summary, we approached the 7 ways of improving fatigue. First, understand your fatigue. Learn to conserve energy, the 3 Ps. Prioritize, plan, and pace. Ensure a refreshing sleep. Exercise regularly. Think, are there any other medical or emotional causes here. Ask your doctor, are any of my medicines worsening the fatigue? Can any medicines help you? Tell others and ask for help. Don't be afraid to say no if you don't have the energy. You can always make your fatigue better. Thank you for listening. And I'll take some questions.
Thank you so much, Dr. Anu. This was really wonderful. So we are going to move now to the next and last speak of today's webinar. And I'm just going to quickly introduce myself again. So I'm Dr. Beatrice Benedetti. I'm one of the consultant neurologists at Cleveland Clinic Abu Dhabi. I got my training mainly in Italy and in the UK, and I've been working in Italy and in India before moving to Cleveland Clinic Abu Dhabi actually 4 years ago. I've been seeing patients with MS since 2003, and I have about 25 publications mainly in the field of MS. So today with you, I would like to talk about 7 future medicines for MS. We can start the recording. Good morning and welcome again, everyone, to this session in which we are going to talk about 7 future medicines for MS. Is there a cure for MS? This is the question that I get every single day in my clinic. And the answer, unfortunately, it is no. There is no cure of MS nowadays, and not even in the UAE, but all around the world. But as we will see in these next 10 to 15 minutes, there are so many medications in the pipeline to become new medicines for MS. So today, we are going to look about the future of MS. And be ready, because we have a lot of exciting news. So this is a website which is called clinicaltrial.gov, which basically puts together all the clinical trials that are going on for all the diseases. So if you type MS here, you will see that there are more than 200 studies going on nowadays on MS, which means there is a lot of research going on for MS nowadays, which is a very good news for you. So before starting to talk about the future, let's go back to the past. I always like to show this slide in which we see how many medications have been approved since the first one, which was 1993 to now. More than 15 medications have been approved for the use of MS. So nowadays we have very good medications to treat MS. However, as I said, there is no cure yet. This is the normal course of MS, the natural history of MS. As you know, MS is an inflammatory disease. You can see the inflammatory part in red, and all those are the MS relapses, the attacks of MS. But MS is not only inflammatory. So over the last years, we have seen that in MS, there is also nerve degeneration. So MS, as you know, is the myelinating disease. So once the nerve remains naked from the myelin, then the degeneration can occur. So the current medication basically works on the inflammation, but this is not the only target for MS medications. Apart from inflammation, we can use MS drugs that work on neuroprotection, which means protect the nerves, neuro repair and regeneration, which means basically repair the nerves that have been damaged, and finally, remyelination. So as I said, and as I'm sure you all know, MS, it's a demyelinating disease. So basically the myelin sheet around the nerves is lost in patients with MS, and remyelination represents a very good target for the future. So let's start from medicine number 1, which is called BTK inhibitors. BTK inhibitors, such as this drug with this difficult name, evobrutinib, inhibits an enzyme which is called BTK, Bratton styrose kinase, and in this way, it reduces the activation of the famous B cells and also works on macrophages, which are other cells that are linked to MS progression. So by doing so, this drug is able to reduce inflammation and also reduce the damage caused to the nerve cells by MS. So it's basically, it basically uses inflammation as a target. let's move to the second drug that I wanted to talk to you about, which is called ibudilast. Ibudilast is a medicine that has been used in the past for the treatment for asthma and vertigo. But actually, it was seen that ibudilast is also a neuroprotective drug, so it works on neuroprotection. They have done clinical trials in patients with relapsing remitting and primary progressive MS, in which they saw that ibudilast was really able to reduce the brain atrophy. What is brain atrophy? So brain atrophy means shrinking of the brain. So you can see in this picture a normal brain, and in this picture here on the right, a brain of a patient with severe MS. So as you can see, the brain is smaller because the brain of people with, the brain in general with aging tends to shrink over the time, right? But in people with MS, it does more quicker. So you can see the same here in a real MRI, in which you see a normal brain here on the left, or maybe a brain of a person with early MS, and the brain of a person who has been having MS for several years on the right side. So basically, ibudilast was able to decrease the rate of atrophy by 48%, which is a very good number. You can see here in this red dot line, people taking ibudilast, developing less brain atrophy, and people taking placebo, which is basically a fake drug in blue here, developing more brain atrophy. Other drugs that we know, such as ocrelizumab, siponimod, they also reduce brain atrophy, but less than ibudilast. And we can find simvastatin here. So let's move to simvastatin. You all probably know statins. So statins are drugs that have been used for many years to reduce cholesterol. So you might even use statins for your cholesterol. Those are very good drugs. But actually, statins not only work on cholesterol, so they also seem to have some immunomodulatory and neuroprotective properties. And they're very safe, and they're also quite cheap. So a study on patients with secondary progressive MS found a 43% reduction in the brain atrophy in people taking statins at high dose compared to placebo. So that's a very good result, and maybe we are going to be able to use high dose statins in the future for patients with MS as well. Let's move to the drug number 4. We have 7 drugs, right, to discuss. So we are now at number 4, clemastine. Clemastine is an antihistamine drug. So it's a medicine that is used for allergy. However, clemastine is also able to go into the brain, and it seems that it can actually help in myelination. So it can be a drug that can be used as a remyelinating drug. Some results from clinical trials suggest that the use of clemastine can actually improve the optic nerves of people with MS. So hopefully in the future, we are going to be able to use clemastine in MS to induce myelination. Okay, so let's move to topic number 5 and 6, a very hot topic, stem cells. So everywhere now, everyone talks about stem cells, and all patients ask about stem cells transplantation. Let's go a little bit more deep into stem cells and let's see what they are and how they work. So there are 2 kinds of stem cells, first of all. The first one is called hematopoietic. The second one is called mesenchymal. Hematopoietic stem cells transplant has been already used for many years in the treatment of highly active MS, and is actually been approved in a few places. Mesenchymal stem cell transplant, on the other hand, it is still experimental, so we can't use it yet. Stem cells are part of our body already. So we all have stem cells inside our body. Stem cells are able to repair and replace damaged or dying cells. They are like baby cells. So those are cells that are unspecialized. They haven't developed yet in any particular cells. And each stem cell has a great potential. They can develop into different cell types, depending on the body needs. So they can become nerve cells or blood cells, they can become muscle cells, liver cells, or whatever. So they have great potential. Let's talk about hematopoietic stem cell transplant first. So the hematopoietic stem transplantation, as I said, has been used for people with highly active MS for a few years now. It basically uses your own stem cells which are collected from your bone marrow, and then they are injected back into your body. Stem cells can reboot your immune system. So basically the goal is that your immune system can regrow in a better way, in a healthier way, after having been destroyed by chemotherapy. So let's see it a little bit more in details. So basically they take the stem cells from your body, from your bone marrow. They work on the stem cells in the lab. In the meantime, you do some strong chemotherapy, which basically completely suppresses your immune system. And then stem cells are put back into your body. And within a few weeks, your immune system should be healthier. But there is a but. Obviously, it seems like a perfect drug, but there is a but. So stem cells are not for everyone. There are only, first of all, there are only a small numbers of accredited centers all around the world that can provide the real hematopoietic stem cell transplant. And it is so far used only in people with very aggressive types of MS. So patients who do not respond to the classical drugs. At least you have to fail one or sometimes two drugs to be able to go for the stem cell. And also mortality is still 0.3%. So it is not very high, but still some risks are there because when your immune system is very depressed, then the risk of infections is high. So let's move to the other kind of stem cells now, the mesenchymal stem cells. So mesenchymal stem cells are different from the hematopoietic stem cells. They actually have some immunomodulatory and neurotrophic effect, and they can help in neuro repair and regeneration. So how does it work? So your own mesenchymal stem cells are isolated from your bone marrow. So they're taken from your bone marrow, they're multiplied into the lab, and then they are reintroduced back into your body in a greater number, either in the vein or in the cerebrospinal fluid in the back with a lumbar puncture. So there is no need of immunosuppressions here. So basically, as I said, they take mesenchymal stem cells from the body, they grow in the lab, they put them back, and there is no immunosuppression here. So it looks like a dream medication, drug. However, as I said, it is still experimental. So we can't use it yet in the clinical practice, but hopefully we'll be able to use it in the near future. So be careful though, because there are a lot of centers in many places in the world, Russia, China, even in the US, which are offering stem cell transplantation for people with different diseases, including MS. However, those places are not serious. Some of them, they ask you money, but you're not really sure they're going to inject real stem cells. And you're not really sure they're using standard protocols and international protocols for these medications. So be very careful. Always ask your doctors before going for any of these treatment. All right, let's move to the last drug that I wanted to discuss with you. So vaccine. So we are talking about vaccine now in the last couple of years because of the COVID. But it seems that maybe in the future, we are also going to be able to have a vaccine against MS. Very recently, in January this year, a study has been published in which they studied an MS vaccine in mice, so in animals. It's an mRNA vaccine, so a similar technology as the Pfizer COVID vaccine. But this vaccine, instead of preventing diseases, it should help tolerating your myelin. So it was seen that in mice with a disease similar to MS, the onset of the disease was delayed, and in animals that already had the disease, the vaccine was able to reduce the severity of the disease. So very exciting, but very early yet. So I have patients who already asked me about the vaccine, but it is very early, so we still need years to be able to use it in our clinical practice. Hopefully it will be a good option, but for the future. We are at the end of our talk now. So what did we learn so far? So the landscape of MS drugs has changed a lot since the approval of the first MS drug in 1990, as I showed you at the beginning. However, there is still no cure for MS, but there has been a lot of progress in developing new drugs for the treatment of MS. current MS drugs are mainly immunosuppressants, so they work on inflammation. However, as we have seen, new therapies that target neurodegeneration, remyelination, neuronal repair, and redegeneration are under development. So hopefully, we're going to be able to use them in the next few years. Wanted to thank you for your attention, and this is the MS team at Cleveland Clinic Abu Dhabi. All right, thank you so much everyone for attending so far. I hope you enjoyed our sessions, and now is the time for you to ask us whatever you want, and we are here. All the speakers today are here now live to answer to your questions, and we have also our Gina, one of the MS coordinators, which will help us moderating this question and answers. All right, so Gina, go ahead. Do you already have any questions? I think we have to unmute. Gina is still mute.
Better. Okay.
So
So
yeah, we can hear you now.
Medication that you were talking about to prevent the atrophy and help with the remyelination, is that in addition to their disease modifying medication or in replace of?
Yeah, I mean, yeah, that's a very interesting question. So the medicine for preventive atrophy don't have any significant anti-inflammatory effect. So they are not able to prevent new lesions. So whenever we are going to be ready to use them, they might be an add-on to the DMTs. So they might be an additional medication that we are going to use on the top of the main disease-modifying treatment.
Okay. And are all the medications for MS available in the UAE in terms of disease modifying therapy?
They are, yeah, they are. So I always tell my patients we are very lucky here in the UAE to have all the medicines that have been approved so far for MS. So no need to travel to cure your or to treat your MS. We are in the process of developing also the stem cells, the hematopoietic stem cell transplantation. But yeah, all the other medications we really have available. So
okay,
we are very proud.
And perfect. That's very good. For Benood, is there any exercise that I shouldn't be doing if I have MS?
So basically, the main thing that needs to be on focus when doing exercise is fatigue. As discussed in this presentation, fatigue is one of the most common symptom that's reported and can affect daily living, quality of life. So there is no such exercises that is said as not recommended for MS patients. Strength training, resistance exercises, aerobic exercises, all that can be done, keeping in mind the fatigue. And as long as the exercise is being done in a cooler environment and making sure enough hydration is done during the exercises, and just moderating the exercises basically through the max heart rate that I explained in my presentation, and that should keep the patients going. There is no exercises that is not recommended. Swimming, running, any kind of exercise can be done, just keeping in mind the fatigue level and the hydration and the temperature of the body, to decrease the fatigue level.
So this falls in line with kind of the same question. I was weightlifting before. Can I still do body lifting, that sort of thing?
Definitely, yes. So depending on, if the person has been doing weightlifting before being diagnosed with MS, and the question is, can I still continue after the diagnosis? Yes, the answer is yes. Again, I will repeat the same thing, just keeping in mind the fatigue, how the person feels the next day or 2 days later, the soreness, muscle soreness, keeping all that in mind. Maybe the intensity of the exercise need to be tweaked a little bit. Talking to a physical therapist, explaining what kind of exercises, what kind of intensity they've been doing, and maybe modifying it based on the patient's activity level and things like that could help.
Absolutely.
So the next question is for Dr. Anu. A patient wants to know what the difference between regular fatigue and MS fatigue. So they were always tired from before in the high school years. Now they're 27 years old. They're newly diagnosed with MS and they feel tired all the time. Is this MS or normal fatigue?
Okay, good question. Tired all the time is not normal. Unless there is a specific, other reason, medical reason, or depression or something like that. So most of us wake up relatively refreshed and are able to do most activities. And unless you have done something extremely rigorous throughout the day, you shouldn't feel too tired by the end of the day. So to be tired all the time seems odd. And in the context of MS is most likely because of MS. So that's the first thing. But then, as I said in the talk, we have to explore why that person is feeling like that. And all the things I said do apply. Is there emotional issues? Is there physical issues? Is there any medication issues? And then we'll have to come to a conclusion. So yes, I think I would recommend that person brings it up next time he or she meets their doctor and raises this concern.
Okay. This next question can be either Dr. Anu or Dr. Beatrice. This person has asked a question that they've been experiencing some tingling, pins and needles, for the past 3 days. It's not painful, but it's on the same side of the body when he or she had her first relapse before. Is this a new relapse? And also the first and last relapse was a year ago.
All right, it's okay. I can answer to that. So, well, it can be a relapse. Yes, it can, but can also not be a relapse. So we know in MS there is something called Uthoff phenomenon. So in case you have fever or your body temperature is hotter, you might feel some symptoms that you had in the past. So let's say if you had in the past a relapse involving your left side of the body, for example, and then the symptoms have gone. But in case your body temperature gets hotter, as I said, for example, if you have fever or you take a hot shower, the symptoms might temporarily come back. On the other hand, yeah, it can be a relapse. You should raise this issue to your MS physician, maybe write a WhatsApp to the MS team and we can arrange to see you in clinic. And by the neurological exam and by talking to you, we can decide if it is the case that you might need an MRI of the brain or the spinal cord to make sure that this is a relapse. So the suggestion would be just talk to your MS team.
Okay. The next one is, can back injury cause MS? Who would like to take that one?
Reply.
So back injury cannot cause MS. So physical injuries are not linked to the development of MS. So no, the answer is no.
Okay. Going in line with that, I frequently feel I have an eyelash stuck in my eye, but there's nothing ever there. Is it just irritation or is this a symptom of MS?
Okay, I can go ahead. It's probably not a symptom of MS. So you should actually see an ophthalmologist. They can check your eye. Let's say there is a symptom of MS, which is called optic neuritis, that can actually cause some discomfort in your eye, but they should be accompanied by blurry vision and eye pain.
Okay.
I have a question.
Go ahead.
I have a question for Kelly. So on behalf of lots of patients who come to us, so first of all, psychology and psychiatry, could you explain the difference for patients who are listening?
Sure. So psychology and psychiatry are different in that psychiatrists have an MD and they prescribe medications, and psychologists, so I have a PhD, but I'm not a medical doctor. So what that means is I will help patients through things like talk therapy. So I tend to focus on helping patients through talking and increasing function, where psychiatrists are able to do things like prescribe medications for the treatment of depression or anxiety.
So is it fair to say that most patients with MS who are going through either grief or sadness don't really need to see a psychiatrist. That mean that someone like you should be able to be helpful and sort the problems on most occasions.
Yeah, so normal problems, things like grief or sadness, most of the time, unless those are extreme, they don't require treatment with medications. And it's often coping with the feelings that someone has can help them to move through them and to move on to build a more positive life. Sometimes if you don't look at the feelings and you stuff them inside and try to eliminate them, that can help you from making positive changes in your life.
And one more question for you. You talked about CBT. So
yes.
What is CBT and how many sessions does one need on average to improve things?
So cognitive behavioral therapy is actually an umbrella term that encompasses lots of different treatments. So this is a question I get a lot. So CBT can be things like sometimes people will give you worksheets and you look at something we call the activating event, the thoughts you have about it, the beliefs or consequences. Or sometimes CBT can focus on things like behavioral activation, so starting to make the changes you need in life. Or it can even focus on things like relaxation and stress management. So it's a broad umbrella term. The number of sessions patients need is variable. So if people are working on, so say adjustment issues, so coping, sometimes people will come for 6 sessions or they'll be fine. And this is true. There's actually something I offer called cognitive behavioral therapy for insomnia, which can help patients with MS. That's typically about 6 sessions. Other times patients will come for a long time. And sometimes people do this because they have severe problems. But other times people do this because they want support from a person who's not a friend or family member. So someone they feel that they can talk to about their problems, who's not going to worry about them, be stressed about them, or even tell their problems to other people. So I have people that I've seen for a very long time for these reasons, even those who do not have serious disorders. I think that's a myth that you have to have some sort of serious psychological problem in order to see a psychologist or psychiatrist.
Thank you.
Yeah, thank you for your questions.
We'll continue with Kelly then, Dr. Kelly. So how do I tell my family I have MS if I'm struggling to? Can they come to a session with me, with you?
Oh, sure. Yeah, that would be fantastic. I'm always happy to help people communicate with their families. I think as in communicating any other significant piece of information, so you want to look at things like timing, things like setting, and you want to focus on expressing how you feel about it. And if you think that could be helpful in a psychotherapy session, I'm always happy to see patients and their families together. Good question.
And another question for you, Dr. Kelly, is I have a family member that has MS and I feel that they're depressed. How can I get help for them if they don't think that if they're depressed?
Well, so you can't make someone get help. This is a question I hear all the time, but you can reach out to them and tell them what you've noticed and ask how you might be supportive. And you can make suggestions on how they might get help. But this is the hard part. It's really difficult to get someone to come in and get help if they're not ready.
Okay. There's a question about Tysabri and the JC virus. If I'm on Tysabri, can I be given JC virus from anywhere else? Like, does it spread to me? You're on mute, Anu.
So the question is, if you're on Tysabri, can you get JC virus?
Yes, by anyone else other than me having it. Can I catch it from general public?
So JC virus is an extremely common virus. 70% of the population have it. And every year, 10% of people who don't have the virus already will get it. But just because you have the virus in the body doesn't mean you are going to get PML. The PML is a rare complication, or a very rare complication of using drugs like Tysabri. So just because you have JC virus doesn't mean you're going to have PML, even though you're on Tysabri.
So answering the question that was asked, can you still get infected by JC virus by somebody else? Yes, you can, but that does not mean you are going to get PML. That is why we do the blood tests very frequently and check if the protective antibody levels or the levels of the virus, are they varying? Are they too high? And is it too risky to continue the medication? Okay. And we will, of course, switch it.
Perfect. Dr. Beatrice, if I do stem cell treatment, does that mean I never have to take a DMT again? Disease modifying.
Excuse me, can you say it again?
If I do stem cell treatment, does that mean I never have to take an MS medication again?
All right, so again, good question. Sorry, I have to apologize because before my laptop died, so the connection interrupted. Anyway, I'm back now. So if you do stem cell transplant, there is the possibility that you might remain without DMTs for the future. However, every case is different. So basically, after you do the transplant, you need a follow-up, and that depending on your disease activity, you might or might not be back to DMTs. Most of patients can remain without DMTs at least for several years.
Okay. And Dr. Anu, is there any medicine to help me with my memory?
The short answer is no. There are no medications that are proven to improve memory in MS. We have, of course, medicines that are little effective in other forms of dementia, like memory impairments due to dementia, but none of them have been proven to be beneficial in MS. But most of the times, 90% of times for the average person with multiple sclerosis, the memory loss is a combination of factors. It is not just because of MS. It's the anxiety, it's the lack of sleep, it's the stress, everything coming to the being overloaded, it's the fatigue. So I think we have to tackle all those things before we attribute the memory loss to MS itself. So again, this is a topic for discussion when you meet your MS doctors.
And I guess follow to that would also be, is there any vitamins that I can take, like a multivitamin, B12, zinc, anything that will help in terms of the memory and the fatigue and things like that?
Yeah, so the only vitamin that is proven, or not at least that we use routinely and make sure people are replete, is vitamin D, which there's more than one role in MS. That is one recommendation. Make sure your vitamin D levels are normal. What about the other vitamins? Well, none of them have been proven to be beneficial as such. But if your levels are low, then it's worth replacing it. Now, are we going to check every vitamin level? No, we aren't. So if in doubt, it is perfectly reasonable to take a multivitamin tablet, which you can buy in most shops, and take one a day. That is done most over the world by everyone who's getting older, I think. Unless you are a fitness person, your diet is perfect. So it's a reasonable thing to do. There are no hard and fast, definite answers for that, but most people take, and that is not a bad thing.
Okay. For either yourself or Beatrice, if I start my MS medication, can I ever stop it?
Okay, so I can answer to that. So once you start MS medication, you're supposed to take MS medications for many, many years. Whenever you will be able to stop it in the future, again, like it really depends upon every single patient. So let's say while getting older, there is something called immunosenescence, in which our immune system gets older with us. So MS might not be so active when we get older. So there is together with also the possible complications of MS drugs, such as immunosuppression, raises the possibility of stopping MS medications at some points in your life. But this is something that we cannot predict once you start. So we start MS medication, you start MS medication, and then, in the future, you can discuss with your physician about stopping MS medications. But as I said, you need to take MS medications for several years. Never stop yourself anyway. Always discuss with your doctor.
Okay, thank you everyone for answering all the questions today. I think that's all the questions we have so far. Yeah.
All right, so I think we are done for our session in English today. An Arabic session is gonna start very soon. So if you also wanna attend the Arabic session, please feel free to do that. And again, thank you so much for spending a couple of hours of your Saturday morning with us today. See you soon.